Wichita today, speaking at the 2024 Governor's Public Health Conference. 12 News reporter Gabriela Hernandez joins us now and shares some of the details from today's event. Gabriela?
Yeah, the governor's speaking in front of hundreds of healthcare professionals about the Kansas healthcare system. But there's one topic she says is top priority. Take a listen.
We can do to improve health in Kansas is to finally expand Medicaid.
Governor Laura Kelly in Wichita Tuesday speaking about pressing matters in the Kansas healthcare system, including the expansion of Medicaid. The governor says she believes it's the most obvious solution for closures and staffing issues facing rural hospitals and clinics.
I don't know how many more rural hospitals, health clinics, and emergency rooms must close before the legislature takes Medicaid expansion seriously, but the answer should be zero.
With hundreds of Kansas healthcare professionals in attendance, those I spoke with say they support the governor's push to not only help healthcare workers, but their clients.
A lot of our clients are lower income, so any type of expansion from the governor's office at the state level can help cover more people, get more people into very needed services.
Kansans are really very much attuned to fairness and trying to provide access to care for all. I think Medicaid expansion would be a logical next step.
However, Republican leadership in the legislature has called Medicaid expansion a non-starter, saying they do not believe it would solve issues facing rural clinics.
Recently, in a rare bipartisan agreement, Republicans joined Democrats in North Carolina to expand Medicaid. I asked Governor Kelly about this, and she says she has been using Governor Roy Cooper's blueprints for Medicaid expansion. She says that she believes it helps Kansas businesses the most.
Thank you, Gabrielle.